Coronavirus, or COVID-19, is really an emerging disease. Although coronavirus itself is not. There are numerous strains of coronavirus, and one actually is the cause for the common cold. However, this strain is unique, therefore novel. Coronaviruses are typically seen in animals such as bats and camels. And it's important to remember that COVID-19 is a respiratory illness, so when we talk about transmission, it actually is through those respiratory droplets. So the cough that isn't covered, the sneeze that isn't covered. We know that in coronavirus that can travel about 6 feet. An individual then can breathe that in through their nose, enter it through their mouth or their eyes, and enters the body that way and then goes to the lung, therefore causing that infection. It's spread person to person. Right now, the individuals that we consider at highest risk are our healthcare providers that are treating individuals that are positive for COVID-19, as well as our older adults, and then anyone that has underlying health conditions, so such as diabetes or heart disease. The interesting part about COVID-19 as a respiratory illness, when you think about seasonal influenza, the attack rate on the youth and the young is much higher with seasonal influenza. But what we're finding with COVID-19, however, is that children do not seem to be more susceptible to this illness. So what is the health department doing? A lot. But if we put that into different themes, planning would be one. So we're working really closely with our business officials, city and county officials, law enforcement, schools, anyone and everyone that would like our help to really think about how are we planning to make sure that our community is ready to respond to this. We're doing a lot of information sharing, Facebook, Twitter, Instagram, press releases, websites. If you don't currently follow the health department, I would encourage you to please do so. We're putting stuff out all the time. So really trying to find the best way to communicate to a variety of different audiences across the spectrum of information sharing platforms. We actually at the health department have a full-time emergency response coordinator. So all year round, we are planning and preparing for any sort of public health response. That could be anything from things like COVID-19 all the way up to flooding, tornadoes, natural disasters, and such. We're also doing a lot of monitoring right now. The health department is currently monitoring over 150 different residents across both counties, and we're doing that through active monitoring or self-monitoring. So I'll use the example of the Fremont exposure back in the end of February. There was a case that had tested positive. She was at a Special Olympics YMCA event in Fremont. We received a list of over 80 residents across both Sarpy and Cass County. We contacted all of those individuals, and then we did what was called active monitoring. So every day they would reach out, or we would reach out to them. They would have contact with the health department. We were asking them to take their temperature twice a day, once in the morning and once in the afternoon, and monitor themselves for signs and symptoms. At any time that a sign or symptom would occur, the health department was there then able to kind of wrap around them and help them take the appropriate next step, whether that be just connecting to a primary care provider or going in for testing. We are also doing contact investigation, and what that means is the instant that we receive a positive case, we are reaching out and doing a close contact investigation. When did symptoms start? Where were they? Where are the places and the spaces and the people that they were with, so that we can reach out to those individuals and provide the proper public health recommendations to really sort of try to contain the potential spread of any illness. And then we're providing a lot of guidance, getting a lot of questions from all different sorts of organizations and residents too, just to try to better understand what is happening with COVID-19, because it is changing frequently. There are multiple layers when we think about risk for COVID-19. You probably all saw the press release that came out on Sunday in the press conference from Douglas County that talked about one Sarpy County location that was listed as a potential mass exposure to a positive COVID-19 case. Those are considered low exposures because every day we're walking past people moving in and out. That would be a low exposure. A high exposure would be an individual that's actually living in a home with a positive COVID-19 individual, or a close contact of an individual that tested positive, and the levels of how public health is responding is much different. So a low-risk exposure might just say, hey, practice some social distancing and monitor yourself for signs and symptoms. But those close contacts, we're actually going to recommend self-quarantine, self-isolation, active monitoring with the health department. There are a lot of things that we're doing now, and I think it's pretty evident. Mass gatherings and events. Just yesterday, that number went from 15 down to 10. That was directed by Governor Ricketts and President Trump. So thinking about social distancing, how are we keeping our space, that 6 feet apart from each other? Thinking about limiting numbers if at all possible, identifying ways for people to engage in regular interactions that are non-traditional, so maybe virtually via phone, things like that. Non-pharmaceutical interventions are definitely one way that we know with no vaccine for COVID-19 that we can help to flatten the curve. So those are things like staying home when you're sick, washing your hands, don't touch your face, which is hard because the minute you say it, you want to touch it. Frequently cleaning and disinfecting high-touch areas, doorknobs, door handles, places, things like that. And then for returning travelers, we're getting a lot of calls about returning travelers. So right now, the health department's recommendation, which is in conjunction with DHHS's, is that any individual that is returning from a CDC level 3 country, which as of right now is China, Italy, Iran, and South Korea, when they return to the state of Nebraska, they report to their local public health department. We recommend self-quarantine for 14 days from the day they left that country, along with active monitoring from our staff. We've also included in that now any domestic travel to areas where we're seeing high levels of widespread community transmission. That list changes daily as well too, but the hot spots that we're looking at now are Seattle, King County, Santa Clara, California, and Worcester, New York. We are asking all travelers, international and domestic, from any place other than those that I just mentioned, to really keep in mind that all travelers at this point are at a higher risk of potential exposure to COVID-19. So limit those public interactions, practice social distancing, and if any signs and symptoms would occur, to immediately isolate and call your healthcare provider. The Department of Health and Human Services, on their main COVID website, has a link in the upper left-hand corner. Anyone that would like help through the health department for monitoring, they're worried about travel, they're worried about a potential exposure, they can go in and fill out that survey. That information gets passed along to us. We reach out to them and then help them sort of through that of monitoring themselves for signs and symptoms.